for my back. I have a scoliosis, and they're gonna change the posture I have in my back to be straighter. And I feel now, like at this moment, a little stressed because it's 5 a.m. in the morning, and yeah, the time is like almost there to go into the surgery part.
And how long is your surgery?
Surgery will be around 12 hours. So that's a long time.
And they're going in from?
The front, and then later on from the back.
Okay. How many doctors?
20 to 30, I believe.
Okay. Where are you?
We are in Istanbul,
What's the hospital?
the Acıbadem Maslak.
Okay. And how does this compare to your feelings for your first surgery, brain surgery you had? What, 7 years ago?
Yeah, it was 2016.
Something short about that.
So the surgery there, I was young, so I didn't understand anything what they were saying or something. So I wasn't like, okay, I'm fine, this is happening, okay, I don't know what's gonna be. And now because I'm 19, I have developed myself more to understand things and how things are meant.
But you feel good about going in?
Yeah, just a little stress, but I feel good, like who the doctors are.
Okay. And what do you expect coming out?
To be straighter because I'm leaning like a lot forward, so to be like then my posture is changing and to be straighter, and that I have more lung capacity, if that's possible.
Capacity, yeah.
Capacity.
And what else? How was your schoolwork, and what are you going to do with that?
So yeah, because we lived in 2020 like on online school, I moved back to online school, so I'm the only one that's having online classes, and that's like mostly do self work, and then if I have questions I can always send the teachers a message like, can you explain this more, can you explain this more?
What's going to be your recovery, you think? What did they tell you? How long?
6 months, and then I can start training again in the gym.
And how much time right now? You're staying in the hospital how long?
A week, till next week Monday is the maximum. If they see I can leave earlier, then I can leave earlier.
Okay, cool. Good luck.
Yeah.
Let's go, do it.
It's stressful.
Alright, look who's back from how long? How long was the surgery?
12 hours.
12 hours. They went into the front, they went into the back. Huge. He's got 2 drains in, one for his chest and lungs, and one for his back, and some other stuff. But the most interesting thing he came with is this little device here, which is
A morphine button.
so as soon as you press it, what happens?
I will get a little bit of morphine inside me, like a shot of morphine.
Okay, so are you gonna charge people on the internet to
No.
press the? No, you're not gonna.
No, that was a joke.
Okay. Good. I'll recover quickly, and we'll keep updating everyone. Hey, Merdan, are you happy with your sex change operation?
Yes. No.
Orthopedic scoliosis.
Yes. Of course.
Okay. How did it go?
It went well, I think.
Yes.
I can't remember anything of it.
But you had pain the first day, right? A lot of pain when you woke up.
But I don't know that.
You don't remember?
No, I don't remember that.
So
Maybe.
they put you back down. Oh.
Yeah.
Okay. So what are you doing now? What? Now this is day 2.
Yes.
You're walking a little bit.
Yes.
How are you feeling?
I feel good. It's not very comfortable because your whole posture is changed.
Yeah.
But I mean, I can feel that, like my chest a little because they changed the amount of air that can go in my lungs, if I'm right, and of course they straightened my whole back. That is something
Okay.
which your whole body needs to adapt on.
Yes. Okay, listen, the question everyone's been wondering about is how many times did you press the morphine button?
A couple hundred times.
Liar. Pants on fire. How many times?
I'm serious.
Really?
Yes.
100 times.
Yes.
Thank God they have it automated so you have a maximum.
I'm joking, just one time.
That's it.
Wow. One time.
You had the thing only once.
Yeah.
Pressing the morphine.
Yes.
Pressing them.
That was the only time.
Morphine going in.
Because that was the only time I felt so much pain that I needed to fix it.
Okay. Okay.
And now it just feels like you trained your back as a beast.
Oh, yeah. But you were throwing up a lot. Like the first day, 2 days, you were throwing up every time they stood you up.
Because all the anesthesia has to come out, I think, because it was a big...
Green.
Yeah, it was green.
Very little food, right?
Yeah, I just had the morning that everything started, like when I walked, I had just an egg and some kind of breadsticks.
And he threw everything up.
Yeah, but that was, it's only water that came out.
But today it's good, right? No more throwing up?
I'm not dizzy.
Okay.
I feel good when I stand up. I still feel like my whole back is heavy
Yeah.
when I try to stand up, but because I know what to do in the gym, like how to deadlift and squat,
Yeah.
I know how to stand up easy and fast
Right.
and still have the right posture.
Good. Good. That helps.
Yes.
What did you think about when you're walking? How does that feel? How does it feel different? First of all, you're taller than your brother now.
Yeah.
By how many centimeters?
I think I am now the 190, maybe 192. Don't know for sure, but
And how tall is the little shrimp?
188.
Oh, the little shrimp. That's his older brother. Finally beat him in height. Alright, cool. Okay, so listen, what's your experience with the hospital? What do you think of it?
I think it's a good hospital. They take very good care of me and they're very serious about like the operation they did.
Well, it's a unique operation. But the other thing is the hospital is very beautiful. I mean, it's like
It's very modern, and it's very new.
Yeah.
And
Restaurants.
it's a good restaurant. I mean, still can't eat there because my whole body needs to adapt on it, on just normal food again. But still, it's. I hope it's good.
Yeah. Yeah. Okay, so when you get out, like of the hospital, which is 5 days, right? And then you have three months of
Recovery.
and then total of 6 months before you can like do everything.
Go back to the gym. Yes.
Yes. Okay. So, coming out of surgery, what is the thing you looked forward to most? Like in food, in doing, in whatever, because you're gonna be.
Yeah. So I hope I can. I want to eat Krispy Kreme donuts because it's been a couple of weeks, like a couple of months that I had that for the last time. So I'm waiting till my body is like adaptive on that food. But yeah, I hope that the gym will go great again and like that I can do more things because of the of the scoliosis I got. I couldn't have like so much weight on my shoulders and back to do squats. So I hope I can like now do squats better than I could ever before.
Okay, so how do Krispy Kreme donuts and squats fit in the same sentence? How do you do that?
Both things what I like to do.
Okay.
So one thing is what I like to eat, and one thing is like when I'm happy about when I trained it.
Yes.
I don't want to train it, but when I did it, I'm happy.
Okay. So listen, another thing is this is not a regular scoliosis. procedure because you have other things going on, and you had a surgery before, like 6 years ago, and so in short, why is this surgery so complex, and why did it have to happen?
So, if I'm correct, I got a NF type 1.
Neurofibromatosis.
Yes. And my...
You were born with that?
Yes, I was born with that. And what my back was like, my back wasn't like...
First your brains.
Yeah.
The brain surgery.
So my brain surgery is... There was a lot of like brain...
Fluid.
brain fluid. So I couldn't focus on some things, and it had so much pressure on my brain that some things couldn't go do because I was feeling sick because of the pressure. And then after the surgery, I did an MRI scan. I did first a CT scan, and then after that they saw that there was like a lot of brain fluid.
Yes.
So afterwards we did an MRI, and they saw like more adaptive that I needed to do surgery, but they didn't know when it's like the right time, because in Holland they always want to like see what happens. Wait and see what happens. But then the doctor in Turkey that did the operation on me, he said I want to do it now.
Yeah.
So then I flew, like a couple of days later, I flew to Turkey and I did the surgery, and now I feel...
It's a bypass surgery for your brain fluid.
Yeah.
So that the fluid can drain back into your spinal cord.
Yes.
Cerebral spinal fluid. Yes. And it was very successful. Right.
Yes. I don't feel the downsides anymore.
Right.
So, I mean, I don't like remember what the surgery was like, because I was like out. But they made a bypass. Like I can feel like they opened it from the side of my chest, and they did a bypass on it to let my lungs have like more air going through, and I can breathe in, because my lungs were at 80%, and we hope we have now more room to have more room for the lungs when I do like weightlifting and
training,
and when I train. And then with the back, they opened it up and then made from the lordosis a kyphosis. They tried to do that, and from the kyphosis they made a lordosis. And that, like with a normal spine, it's that where the places were, it was with my back, it was switched up.
Yeah. The side view. And then frontal view, you had the S, like the snake, and they fixed that too.
Yeah.
Good.
So who were here was my mom, my dad, Mr. Dr. Richard Visser, and then I believe my sister and brother, and my stepbrother was here too.
I believe.
And a friend of my mom was here. So in total 7 people.
No. Elon.
Yeah.
And my aunt was here too.
Uncle.
And my uncle.
So we're helping him now.
Yeah.
He was morphined up.
Yeah, I had a lot of drugs on me.
Not on him. Not on him.
Inside of me.
Yeah. He had a lot of drugs on him. Mule. Okay, listen. So one thing happened right off the bat after surgery. What was that?
So what happened was that we did after surgery. Before the surgery, I mean, I had a lot of pain in my quads, and it was like pain that kept constantly. And then
How many years?
Around 2-3 years maybe. And then the doctor said like, okay, we can do the surgery, but we don't know what will happen. So it could be gone, or it could be going to go worse because your body is adaptive on the spine and how your body is like walking and how your body is like the structure of your back is with your legs. But so after surgery, I mean, I hope when I'm right that now all the drugs are out of my body and I don't feel any pain
In the legs.
in the legs. No, I don't feel, and I had that pain so many times. And the only thing is, I feel now a little muscle pain because I'm laying down and I don't walk.
You're healing.
Yeah, I'm healing. So I think that's now the only pain I have is only a little muscle pain.
Awesome. All right. So how did you feel coming out of surgery? What happened in surgery? What do you remember?
So the first hours I don't remember, like after I woke up, because what I was taught is I was in so much pain that they give me like so high pain medication that I would like fall back asleep. And then afterwards I woke up at 2-3 a.m. I think. And then I got like, I felt pain, but not so much. So I got like a little pain medication, and then later the nurses came and they were like keeping me company. They talked to me, and they were very kind. It was a very sweet woman, like mother and daughter together. They were helping me. So that was like a very good like evening to have like as your first night of surgery.
But then your mom came in, but you don't remember that.
No, I don't remember my mom came in because that was like right after the surgery. And
how long was the surgery?
12 hours long. So it was a long surgery. It started around 9 a.m. and it ended so like at 9 a.m. And then on Tuesday morning I had a little breakfast, and then I got moved to my room where I stayed in for like where I stayed in. And little by little, like there was like little ups and downs. But the first day I went immediately walking, starting to eat and like drink a lot of water because that's what you need a lot from.
How were you feeling? Because you had a pain medication. What did you have for pain medication?
Yeah, so the first day I had morphine. That was a very high one, and I pressed it just once.
What did you feel?
I don't know what I felt. It wasn't like it was. I didn't feel like it was a pain relief thing. So I don't know what it like really was.
Did you feel anything weird?
No, not of that.
You just didn't feel any pain.
Yeah.
Okay, and then?
And then like afterwards when I started walking, the morphine didn't like went good on me. So I threw it up.
Yeah.
Yeah.
You vomited.
Yeah.
A lot.
A lot.
Okay, and then we saw that I think you weren't going to the bathroom. Your intestines were kind of paralyzed.
Yeah, but that came a couple of days later. Which like the toilet was something that didn't work out. Of course, like peeing worked, but the like going to the bathroom didn't like for not peeing didn't work out. So there was like a lot of gas in my intestines that couldn't go out. So in the last 2 days, 2 days they put me on medications, like high medication, and then they tried to get it out like for 4 days straight, but it didn't work.
What did they do? What did they try?
They tried on the first day only laxatives. On the second day they tried it with a serum and first, and that didn't work, so they tried it with water.
Colonic.
What?
Colonic.
A colonic. And that didn't work also, but on the third day they tried it again.
They did colonoscopy, right?
Yeah, but they tried it first with the water.
Yes.
And if that didn't work, they would do an egoscopy. And after that, they would take out as much as they could, and then your body needs to adapt it. And
But this is a common thing that happens to a lot of patients with back surgeries
yeah,
and anesthesia.
yes. So that's completely it's completely normal that this happens to your body. And it won't and and after you have a high medication, your body will work and start again how it's supposed to be, so your body will
But that's a week.
yeah, it was a week long.
Was at times the pain bigger than the back pain? The stomach pain?
I think because of my stomach pain, and my stomach was so bloated out that had so much pressure on my back, and your back is a whole wound, so you will feel that so much, that the pain was so high that it was some days you could handle it and some days you couldn't handle it because it was such pain in the ass.
How, from 1 to 10, or were you pain on the stomach?
So on the stomach it was probably between a 7 and 8, and then on a Friday night it was a 10 for my back. My back hurted so much.
Because they were trying to bring you off the
yeah,
painkillers.
that also, but I couldn't still, because it was still too early. And yeah.
So you didn't eat any food for how long?
I was eating a little, but not I was drinking since 2 days ago, 2 days. So Saturday, I started to drink AG1. That has it has microbiomes in it, vitamins and minerals, so that will keep your body moving, and try to move it again and try to move it more. I had some fruit and a handful of raspberries and a half a bar of protein, and yeah, that's it, and some bites of a burger, but it is.
How, since the surgery, how many days till now?
How many days from the surgery?
Yeah.
I was in the hospital.
Yeah. How long from the surgery till now? How many days?
It was 7 nights, 8 days.
Okay. And maybe tomorrow you go home.
Yeah, I hope so. I hope so. I will go home on Tuesday.
So how's the walking been going? And stuff?
Walking is good, I think. Sometimes I'm still a little not stable, but that's totally normal because your spine is totally different than what you grow to your whole life. And after that, you will after the whole wound heals and your body's totally adapted, that's you can do things earlier, but full when your back is back at 100% is 9 months, so it's a long time, but still it's something that's you can go around after 6 months, you can go to the gym, and after 3 months you can do other things, so it has passes of 3 months, so what's more they're more positive, that's not everything at once.
Yeah. So every 3 months you kind of upgrade what you can do.
Yeah. First 3 weeks, that's like the biggest pain. And then you have 3 months.
When do the stitches come out?
2 weeks after surgery, I believe.
Okay. And they were what type of stitches?
I don't know.
Like steel.
Yeah, the one. I don't know how you say it.
Yeah. Neat.
Yeah.
Yeah.
I believe it was that.
Yeah. Oh, tell me about you. How many tubes did you have in your back? What were they doing? When did they come
I
out?
had 2 tubes in my back, and 1
For
tube.
training?
Yeah, and 1 tube on the side of my, like right above my stomach and like at the end of the ribs where my lungs were, because that's also a part where they came in to make room for my lungs. And then and the tubes were drew like they would take, what would they take, some blood out or something?
Yeah, they were drainage.
Yeah, they would drain like blood so your lungs won't fill up with blood, because too much blood is not like.
It's from the surgery and also to get your lungs back into the space.
Yes.
Okay, so tell me about the surgery, because they went in on the front of your spine
Yes.
and they went in on the back of your spine.
Yes, so they first went in the front. I really don't know what they did, but like what I was supposed to do was like making room or like pushing the lungs in.
No, they actually did the spine. They did the ALL release.
Oh.
So they can move the spine back.
Okay, they removed from the front a little bit of the spine, and then afterwards they stitched it up, and then they turned me around, opened me from the back, and then pulled my spine fully straight, because you can't like go in a normal back. I mean, afterwards they can see how much they did, but like
They went from a kyphosis to
to
lordosis.
Yeah.
Actually, sorry, they went from a lordosis to kyphosis.
Yes. And that's
minus 35 to I think +1.
Yeah, maybe. We have the official scans of the AOS.
That's amazing. And then they straightened it.
Yes. So 2 I don't know what they.
Titanium rods.
Yeah, titanium like rods. Lines or rods, and they screwed it like in the back. But is it safe to go back and to go in an MRI, because your body is, I mean, I need to go sometimes in an MRI, but is it still safe, because metal and steel can't go like close to the machine?
Yeah, but it's titanium.
Oh, and titanium is safe for metal?
You already have an MRI done. And you have x-rays which will show.
Yeah, but like after, like for the brain surgery part.
Yeah, but they already did an MRI with the new screws in and everything.
They didn't do an MRI.
I think I saw one.
That was CT.
Oh, that's CT? Okay.
Everything was CT, no
that's
MRI.
A good question. We should ask the doctor. I think it was fine. Okay.
So.
Okay. And what do you see, what do you look for? Oh, you had your first meal. What was your first meal?
So my first meal was like, you mean the non-hospital food?
Yeah.
So my first non-hospital food was a greasy Shake Shack double cheeseburger, and that had such a good like relief, because hospital food is not always the best. Although the hospital food in this hospital was okay. It was like
it's a very luxurious house.
For hospital quality food, it was really, you had really good like meals.
How did you like the hospital? Because you've been to hospitals in Holland, Europe.
Yeah.
Here, how does it compare?
I mean, Holland, you have some hospitals that they don't like renew like it takes a long time.
Oh, so they're older.
Yeah.
The hospital is new.
Yeah, so and you have newer ones that they like did whole restructure of it because they wanted to look modern. And this hospital where I'm in now is I believe very new. I don't know for sure, but it looks very new. It has like high-tech equipment. Like you have a good TV, you have a good quality of nurses and everything.
Yeah, it's very nice.
Yeah.
Design.
The design is cool, although I don't see a lot of it.
Yeah, but they have nice restaurants.
Yeah, they have a Starbucks, they have everything inside.
Cool. All right, so we're looking forward to your recovery.
Yes.
Okay. This is probably your last message from the hospital. After this, we'll record you at home.
I hope so. Yeah, of course, nothing will happen, but...
Yeah. So anyway, in this last thing, what do you have a message for the nurses and doctors that helped you? How many doctors were there?
Like the team of doctors that did, they weren't like at once in one room, but it was around 20 to 30 people that were there, like in total in the 12 hours they did surgery.
What do you have to say to them?
Yeah, thank you very much, and of course to the nurses here. I know you guys have like long days from like 7 a.m. till 7 a.m.
PM.
7 a.m. to 7 p.m. And yeah, so if you work 12 hours a day and you like see me every time pressing a button and then seeing I have this and this pain and this pain and this, then you're like, okay, I'm happy that you guys still like, of course it's you guys' job, but still it's something that's like you're still happy about if they do it. Like they don't say, okay, you have to sleep now and then tomorrow morning you will get new things. You can't ask things in between the nights or between the nights now. You just can ask everything what they want and they will do the best what they want.
Right. So the care was really, really good.
Yeah.
In Acıbadem.
That's for sure.
Where's the hotel? What is the hotel's name? At the hotel.
The hospital where I am is Acıbadem. It's a big, let me explain. It has.
Say where it is.
Yeah. Okay. Acıbadem is like a big hospital. Like has multiple hospitals. Like, and they have multiple in Turkey because it's a Turkish hospital group. They have one in Holland, and then I don't know if they have any in the United States. I don't think so. But where I am in is the Acıbadem in Maslak, and Acıbadem Maslak was a good hospital if you need anything, and you don't want to pay the American prices. I mean, the prices here were also high.
It's private. It's the highest in Turkey.
But it's less than the American prices.
Yeah. All right. Cool. So bye-bye.
See you guys when I'm home.
Okay, message from Merdan.
Thank you guys for being here and like being here for me and make me feel like better to be here and make me feel happy that everybody is here.
See you later. see you later, guys.
Oh.
Thank you.
See you later.